48th annual Capitol event is underway in the nation's capital.
Local leaders talking about a number of issues, including help for the homeless. Fox 40's Paul Robbins is live in Washington, D.C., bringing us this report. Good morning, Paul.
You know, it is interesting, ladies. I'm with this extraordinary group of people from the greater Sacramento area, and they all tend to be problem solvers. They want to do all they can while they're here, and as you just said, homelessness, it has to be perhaps the most elusive problem that we have. How hard have we tried and how many resources have we thrown at it, and yet it seems to be worse and not better. With that in mind, let's talk to a service provider. Erin Johansson, you're with, first of all, TLCS.
Yes.
Most of us have not heard of your organization.
Yes.
Tell us what you do.
So we're a mental health and supported housing organization serving Sacramento County for the last 37 years.
Shame on me for not knowing. Thank you.
And we actually hold the very first HUD grant that ever came to Sacramento County. So that's really the funds, the federal funds that the Continuum of Care uses to house homeless people. So we matched that up with Sacramento County Division of Behavioral Health Services, the service piece. So services and housing for some of the hardest to serve, seriously mentally ill, chronically homeless adults.
And again, it is so complicated, and that went by so quickly.
Right,
I know one of the things you do is you partner with local organizations. I know you partner with Dignity Health.
Absolutely.
And others to provide unique services to people in the community. How does that work? What do you do with Dignity?
So we have actually two programs with Dignity. One is called the Triage Navigator program, and that is where we have embedded staff in the local hospital emergency rooms and the jail and Loaves and Fishes to interact with folks with experiencing a mental health crisis, most of whom are homeless, and help connect them to services. And this is to prevent unnecessary emergency room visits, which are not good for the person and they're not good for the system.
Okay, I can't wish this into existence, but I'm going to ask the question.
Sure.
As we watch homelessness and we follow it in the news, it seems to be getting worse and not better. After 30 years, is that your perception, or are good things happening that we might end on a happier note?
Well, it is my perception, and it is the reality that it's getting worse. And the biggest problem that we face, and the reason we're here at Cap to Cap, is because although the community has done heroic things to put services in place, what we don't have is enough affordable housing so that folks can be housed while receiving those services. So Dignity Health and others like them partner with us to provide substance abuse services at some of our facilities, which are key to successful stability and housing. We still need the housing supply to grow.
And we've been talking a lot about that on this Cap to Cap trip. Thank you so much for your time and for the last 30 years of serving people in our community.
Much.
You bet. So, again, what a challenge, and yet people are trying to meet that challenge as best we can. The Cap to Cap trip with so much of the greater Sacramento region here, trying to make an impact in Washington, D.C. That will reach all the way back home, ladies. Back to you.
Trying to make an impact and take some action. Thank you, Paul. Another troubling turn in Syria just days